Now let's welcome Jill Ward and Angie Blackwell. Welcome, Jill and Angie. It's such a pleasure to have you both here today.
Thank you. We're excited to be here.
Yeah, it's a great topic, and I'm excited to hear about this. So, Jill, you've been on the show a couple of times, so folks out there probably know who you are, but remind us a little bit about you and what you do at the organization.
Yes. Well, I am over all of nursing at Novant Health Brunswick Medical Center. If you're a nurse or you're a CNA or a tech, you kind of work under my umbrella. So I'm actually the chief nursing officer there.
Great. And how about you, Angie? Tell me a little bit about yourself and what you do at DaVita.
Sure. I'm a group hospital service administrator for DaVita, and I cover the entire North Carolina. So what I do is I oversee the acute departments for DaVita.
And acute meaning
acute
folks
dialysis.
Who are in the hospital?
Correct. That's right.
Well, I know that that was recently, that program was recently begun at Novant Health, so I'm excited for our community to know about that. So I understand that it is a relatively new partnership between these two organizations. So Jill, tell me a little bit about that. How did that occur?
Last year, 2019, the beginning, we started kind of having conversations with DaVita, with Southeastern Nephrology, our group that's on campus with us, and just started talking about how can we make this happen for our community, bringing us a new service line to our hospital. So we had many meetings and did some walkthroughs and just talked through things and what we would need to start a dialysis program. And so this year it actually came to light. January 13th was our original start date, and we've done really good.
Yeah.
I'm very excited.
And what does this mean for the patients in our community to have dialysis here at the hospital?
Well, it means that they won't have to be transferred to another hospital outside of the county. If they're having any type of procedure and needing to stay overnight in the hospital and they're a dialysis patient, we can offer the services so they don't miss their treatments. And
before that, they would have to go to like the tertiary care facility.
Absolutely.
Right. Yeah.
In order to have or maintain their dialysis.
Exactly.
Correct?
Correct.
So are there limitations to the type of patient that the hospital can take care of?
No. We will see any patient in the hospital that needs dialysis, no matter who their provider is.
And so is that decision made by like the hospitalist team? Do they oversee that, or how does that work, Jill?
The hospitalist would consult nephrology, and then they would see the patient.
And then nephrology
would write orders for dialysis.
Well, Angie, tell me a little bit about your team and how that service works at Novant Health Brunswick Medical Center.
So what we do is we bring in a specialized care team to partner with the hospital caregivers to deliver dialysis and make it easy and accessible for the patients in the community.
And so when you're delivering these services, is it your team members are there with the patient and the equipment?
Exactly. So what we do is we do the entire treatment and we stay at bedside with the patients. We never leave.
And how long does a typical treatment last?
So typical treatments last 3.5 hours to 4 hours. It could be less, it could be more. Depends on what the output of the patient is in lab work. It's a lot of things that doctors use to measure what the actual amount of time that patient would need.
Now, does the nephrologist stay at bedside, or it's the DaVita team?
It's the DaVita team. For new starts, the nephrologist may be in the building or nearby just to make sure that everything goes well. But they are only a phone call away.
They are.
Yeah.
Yeah, they're just down the street.
Right.
Actually. So Jill, tell me, how are the nurses and the doctors responding to this new service at the hospital?
Very excited.
Yeah.
Anytime you're a nurse and you work in a facility where a new service is offered, it's really, really exciting because the nurses get to get a lot of education, and so it helps them.
They probably learn a lot of new stuff.
Yeah.
But do they do anything in terms of dialysis, or they just continue the regular nursing care that they're doing and DaVita takes over?
Right. They continue the regular nursing care that happens. They administer their meds. They do all the things they typically would, but they get to really work with the DaVita nurses because they can kind of see what DaVita's doing and
That's kind of cool.
just help them monitor the patients and just make sure that everything's going smoothly. So they work really close with the DaVita nurses.
That's kinda
so it's
cool.
fun and exciting when you get to learn a new service line. Yeah, it puts that in their, not sure what word I'm trying
Sort
to
of
say.
in their bailiwick of services.
Right.
Well, this is a dumb question, but can you eat while you're having dialysis?
Well, normally, no. We don't like for patients to eat because
Okay.
sometimes they get sick on their stomach and, have some gastro issues going on. So
But they can like read books and
they
watch
can.
TV
They
and all that
can.
stuff?
They
Like
can. Yeah.
puzzles.
Yeah.
Yeah, absolutely.
Just something to pass the
Talk to
time.
us. Like we get so much out of just sitting at the bedside talking to patients. We learn about their families. They learn about ours, and so it's a time to bond. So and that's why we love it so much because of those patients.
Yeah. So up until this new partnership, then if we had a community member who was really sick and coming to the hospital, they couldn't even come to Brunswick. Is that correct?
Correct. Our EMS would transfer them to a facility that actually provided dialysis.
And so now that's all changed
That's
for
right.
the residents of
That's
Brunswick
right.
County.
That has
That's right.
changed.
They can be cared for right there at Brunswick and know that DaVita's expert team will be on site to support them.
Yep.
That's awesome.
It is awesome.
It is.
It's exciting.
And how about the equipment? DaVita brings the equipment
Right.
with them, is that correct?
Right. Well, we purchased the equipment. The equipment stays in the hospital.
Oh, okay.
Yeah. So when we get there, we just pull the equipment from our room and just set it up and do dialysis.
Oh, that's what I was going to ask. So they don't have to move from one room to the next.
No.
It's right there in their own bed, right?
right. That's right.
Right.
At bedside.
Oh, wow, that's great. Well, before we wrap up, that's a lot of information, is there anything else that you would like community members to know about this new service? I think we've pretty much covered it, but
I think we have. It's just really something that's exciting, and they can stay in their hometown. actually.
Exactly.
and it's good for their family and stuff.
That's right.
They can come visit and maybe sit and talk to them for that 3 hours.
That's right.
They're sort of a
Absolutely.
captive
Yeah.
audience. Well, thank you both for being here today.
Thank you.
Thank
It was a
you.
lot of good information, and I'm glad that we're able to provide that service to the residents of Brunswick County.
Thank
We
you
are
so
too.
much.
Thank you.
Thank you so much.